Okay, I'm ready.
Good morning. Welcome to the Healthworks Workforce Initiative COVID-19 training module for community healthcare workers. My name is Donald Alcendor. I'm an associate professor at Meharry Medical College in the Center for AIDS Health Disparities Research in the Department of Microbiology, Immunology, and Physiology. I'm an adjunct associate professor in the Department of Obstetrics and Gynecology at Meharry. I'm also an associate professor adjunct in the Department of Pathology, Microbiology, and Immunology, Division of Infectious Disease at Vanderbilt University Medical Center. I am currently the Director of Research for the Tennessee SEAL program, which is a partnership for the Healthworks Workforce Initiative between Meharry Medical College and Morehouse. I'm a former voting member for the HHS Vaccine Injury and Compensation Program. I'm also a former voting member for the FDA Antiviral Advisory Committee. I'm an expert advisory panel member for the American Lung Association COVID-19 Action Initiative, antiviral and immune modulating therapies, health promotions, and pandemic related social, behavioral, and racial disparities. I also sit on the American Lung Association Scientific Advisory Committee.
Good morning. My name is Rafael Santiago. I am the Director of Training for Tennessee SEAL at the Meharry Medical College. Today is July 8th, 2022, 8 a.m., and we are going to begin our COVID-19 training modules for community healthcare workers. These modules will also provide you the Doctor, could you remind me
CME, 5 CME credits for
yes,
these modules.
you will receive 5 CME credits for these modules. Our presenter today has already been presented, Mr. Dr. Donald Alcendor, and we look forward to you guys just learning a lot today and being able to experience the COVID modules that have been prepared.
Thank you, Raphael. So module 1, general information about coronavirus 19 or COVID-19. So to date, there are 7 human coronaviruses that infect humans. We've been identified including 2 alpha coronaviruses, which we call HCOV 229E, and again, HCOV NL63, and 5 beta COVID viruses, that is OC43, HKU1, and of course the 3 viruses that cause a severe acute respiratory syndrome and produces a condition called ARDS, which is acute respiratory distress. This is the SARS coronavirus, the Middle Eastern Respiratory Syndrome virus, or MERS, and most recently, the beta COVID SARS-CoV-2 virus that causes COVID-19. The learning objectives for this module. After this module, you should be able to know what COVID-19 is and how it causes disease, know unique features of COVID-19 virus that makes it more pathogenic, know how the virus that causes COVID-19 spread from person to person, identify symptoms associated with COVID-19, and know mitigation strategies to reduce the spread of COVID-19. This is the coronavirus family. And again, can see the subfamilies there. Most of the coronaviruses that infect humans are in the coronavirinae family. And of course, the human pathogens, you can see there the 4 commonly circulating coronaviruses. And of course, the green, red, and blue arrows point to those coronaviruses that infect humans that cause acute respiratory distress, which is a type of lung failure that can be life-threatening in people that acquire COVID-19, especially for SARS-CoV-2. You can see that the mortality rate for SARS-CoV is about 10%. For SARS-CoV-2, it's about 3 to 5%. And for the MERS virus, mortality rate is as high as 35%. So if we look at a schematic of what the coronavirus looks like, in this cartoon, what you can see that is most important is the spike glycoprotein that I have there with the red dot. This spike glycoprotein is the basis for the virus being able to interact with cell proteins, in this case, the ACE2 protein on permissive cells in the body to initiate the infectious process. The spike protein sequence is the sequence that has been incorporated in the mRNA vaccines for Pfizer and Moderna. There are also proteins that are translated from this particular transcript in the other vaccines as well. So the basis for all of the vaccines are directed against producing antibodies to this spike protein, which represents a neutralizing antigen that can prevent the virus from entering cells to initiate the infection process. So in terms of what we know about the SARS-CoV-2 virus, it belongs to the clade 2 of coronaviruses. And when we look at the entire genome of this virus and we find out what particular animal species that is closest to the SARS-CoV-2 virus, it is the bat. However, from the bat to another intermediate zoological host that we don't know of, it is then transmitted to humans. So we are still in search of the intermediate zoological host in which the virus is transmitted from the bat to humans. And what we know is that this virus can easily be spread in the environment. It is highly transmissible. And again, this virus is spread through our T-zone, that is our eyes, our nose, and our mouth. So talking and coughing and sneezing and wiping your hands, wiping your eyes with your hands can transmit this virus to a contact. And of course, if you cough and then you wipe your mouth or your nose or sneeze with your hand and you shake hands with another person, you can transmit this infection to another person, especially them using their hands to wipe their mouth, their eyes, or their nose. And of course, if you cough and you deposit mucus on a formite surface like a table, a doorknob, and so forth, a person then can touch these surfaces and transmit the virus to themselves by way of their T-zone and facilitated by the hands. There's a difference between droplet nuclei and airborne transmissions. You can have large droplet nuclei that are greater than 5 microns in diameter, or you can have those that are less. So the larger droplets that are more than 5 microns will be deposited locally. Those that are smaller can travel farther and exist and persist for a longer amount of time in the air. In particular, in a situation where you have a person in an elevator, that's a closed space that's unventilated, these particles can persist in the air and transmit the infection. By way of saliva, when you talk, the saliva has been found to be a very important diagnostic specimen. But again, when you talk, it turns out that there are cells in the mouth, particular salivary glands, that express the ACE2 protein that the virus binds to via the spike protein to initiate infection. So you have cells in the mouth that can support infection of the SARS-2 coronavirus. And of course, when you talk, there's aerosol along with large droplets that can be put into the air or on formite surfaces to facilitate transmission to another person. The ACE2 protein is everywhere. So when you look at the nasal cavity, the lungs, the gut, the heart, the eyes, liver, bladder, kidney, pancreas, brain, prostate, and placenta, these are just a few places in the body where the ACE protein is expressed, making them potential target cells for the SARS-2 coronavirus. This virus is known to cause systemic infections. Again, the lung is the most prone organ in the body to initiate the infectious process that leads to other problems that can be systemic. So multi-organ disease via coronavirus infection does happen in those individuals that suffer acute, severe manifestations of SARS-CoV-2. So you can see here the ACE protein is on the surface of a cell, and you have the TMPRSS2 protein that serve as a co-receptor, and by a coordinate binding and cleavage by the serine protease that you see there, the TMPRSS2, you have internalization of the virus into the cytoplasm of the cell. Now, When it's in this endosome, the endosome acidifies and allows breakdown of the viral capsid proteins, releasing the viral genomic RNA into the cell to initiate transcription and expression of viral proteins that lead to virus replication and subsequent infection, release of progeny virus to infect neighboring cells, and now you've got a full-blown infection. ACE2 expression exists in many different organ systems in the body: the central nervous system, the upper airway, the vasculature, the lungs, liver, eyes, heart, kidney, and gut. There are a number of cell types within these organ systems that are prone to infection because they express the ACE protein, which is the receptor binding component for the virus. There are a number of genetic variants for the SARS-CoV-2 virus out there. SARS coronavirus is a large single-stranded RNA virus. Within that RNA viral genome, you have a number of viral proteins. You can see the spike protein there. And what they have done is they've looked at a number of virus isolates from different patients and have been able to identify many mutations in the spike protein. And these mutations in the spike protein gives way to the emergence of different viral variants. These variants can oftentimes be more transmissible, highly infectious. They can also lead to immune evasion as well. And these different viral variants, as they arise, can give rise to different surges in the general population in terms of infection. And the idea is that you can have an increase in cases, hospitalizations, and ICU admissions as well because of these variants that emerge. As long as we have virus replication in the general population, especially among those that are unvaccinated, we will continue to have the emergence of these viral variants. And so when we look at COVID-19 associated diseases in multiple organ systems, we can see in the heart, you can develop symptoms of chest pains. You can have myocardial inflammation in the heart due to COVID-19 infection, upregulation of serum troponin levels, and palpitations of the heart. These are usually individuals that have severe symptoms associated with COVID-19. In the lungs, you can have shortness of breath, chest pains, and you can have uncontrollable dry coughing. In the pancreas, you can have pancreatic injury that leads to pancreatitis. Those people that have severe COVID disease can develop renal impairment and acute kidney injury. You can also have gastrointestinal tract disturbances in the form of diarrhea, nausea, and sore throat. In the brain, many individuals that develop severe symptoms of COVID-19 that may lead to long COVID or post-COVID syndrome will develop brain fog, delirium, severe fatigue, have sleep disturbances, experience depression, anxiety, PTSD, or OCS. In the spleen, you can have a reduction in T and B lymphocytes and atrophy of lymphoid follicles. In the liver, you can develop liver injury, increase in liver enzymes that indicate something is wrong with liver function. In the blood vessels, you can develop inflammation, vascular damage. You can have small clotting in small vessels and so forth, and microangiopathy as well. All of these organ systems produce ACE2. All are subject to infection by the SARS-2 coronavirus, and many of these different symptoms within those organ systems can develop. There are certain individuals that are at higher risk for the most severe complications of SARS-CoV-2, and that is individuals that are older than 65 years of age, those that have chronic lung disease or asthma, those that have serious heart conditions like congestive heart failure, those that smoke or have COPD, those that have compromised immune systems, including people with HIV/AIDS, those that are cancer survivors, have diabetes or obesity. And the idea is that these conditions are not subject to people that are older. There are many young people that have chronic lung diseases and asthma, many young people that have heart disease, many young people that are immune compromised, many teenagers that are obese, many young people with diabetes, and cancer survivors as well. Social determinants of health are the foundation in which we all interact with uh, uh, everything that goes on in our life, but even virus infections and even this pandemic. And so when we look at social determinants of health, we have to see how our economic stability stands up within these times of need during this pandemic, because the social determinants of health of underserved populations were at a critical point before the pandemic. And the pressure of the pandemic, uh, loss of loved ones, loss of finances through loss of a job, having children out of school, having less access to healthy foods at that time, uh, poor social interactions with people that we work with and interact with. And so when we look at economic stability, our employment, income, expense, death, medical bills, and support, all of this has a lot to do with how we will fare during a crisis like this pandemic. Housing, transportation, safety, playgrounds, workability, zip code geography. And of course, the neighborhoods that we live in have a lot to do with community spread of this infection and the likelihood that you may develop COVID over time. Education, literacy, language, early childhood education, vocational training, and higher education. Our education allows us to understand more about this virus, understand the importance of getting a vaccine, the importance of mitigation strategies to prevent community spread. Food, we know that nutrition is very important uh, uh, to allow a person to have the health and wellness required to sustain themselves during this time. And of course, nutrition has a lot to do with your immune system, your ability to fight infectious diseases. Community and social context, your community support, community engagement, how you are treated when you go to the doctor, the stress conditions that you have during times of uncertainty during this pandemic, the healthcare system that you interact with, your healthcare coverage, provider availability, quality of care. All of these things matter when it comes to your ability to confront the problems that are associated with surviving through this pandemic. So, as we said before, through your T zone, by way of coughing, sneezing, or talking. And of course, wiping your T zone using your hands can facilitate transmission to another person. The most common symptoms associated with COVID-19 is what you see here: fever, fatigue, chills, headache. And of course, some of the most severe symptoms will be loss of taste and smell, chest pain, shortness of breath. So when we think about those common symptoms of cough, fever, fatigue, body aches, shortness of breath, there are some uncommon symptoms that includes headache, nasal congestion, loss of taste and smell, coughing, trouble breathing, pain, chills, nausea, vomiting, and diarrhea. And again, if this can lead over time to more severe symptoms of COVID-19 that includes pneumonia, coughing up blood, leukopenia, and kidney failure. So we also have to be able to do differential diagnosis in terms of exactly what it is that you have, because there are some commonly shared symptoms between COVID-19 and the flu. And so when we look at fever, cough, body ache, tiredness, we see that that's commonly shared with influenza virus infection. But what we see that is a clear difference between influenza and COVID-19 is the loss of taste and smell and the shortness of breath. These are two serious symptoms of COVID-19 that often are associated with more severe disease and will require a physician to intervene. This may also lead to a hospitalization as well. And so the clear difference between the cold and flu in terms of symptomology loss of taste and smell, and shortness of breath. Usually that is not associated with influenza infection and more likely to be symptoms associated with COVID-19. So if you want to stop COVID-19, there are a number of things that you want to do. First and foremost, and this should be prioritized by community healthcare workers, is to get the COVID vaccine and to wash your hands and wash them often, especially if you're interacting with other individuals or touching a formite surface that is regularly touched by other people. Cover your mouth and nose with a mask, and you have to do this in a proper way. Avoid crowds and practice social distancing. And of course, if you're vaccinated, this becomes a little different. But again, during these times of high community spread, it is very important that we practice social distancing, especially if we're indoors. And again, as community healthcare workers, you are urged to report any fraudulent COVID-19 tests that are out there, any fraudulent COVID-19 vaccines or treatment to the FDA. In summary, this module provides you with general information about the coronavirus, pathogenic features of the virus, COVID-19 disease, individuals at high risk for infection, mechanisms of viral transmission, COVID-19 symptomology, and effective mitigation strategies to prevent the spread of COVID-19 disease. Moving on to the next module. Module number 2, actions to prevent the spread of COVID-19. How can you protect yourself from COVID-19? Wash your hands. And again, it's important that you wash your hands in the proper manner. So you want to clearly wet your hands, okay, completely. Then apply soap or detergent of some sort. Soap acts as an emulsifying agent that will then trap bacteria and germs and allow you to wash them away. So then you have to scrub your hands with soap for 20 seconds. Then rinse with water completely. And then dry your hands with a clean towel. Your hands are now clean. And of course, sanitizer. So how to use a hand sanitizer to protect yourself. Apply the product on the palm of your hand, of one hand. Rub the tips of your fingers with the palm of the other hand. Make sure you get the back side of your hand as well. And rub your hands together until they're dry. The learning objectives for this module. After this module, you should be able to practice protective measures to prevent the spread of COVID-19. Should be able to educate people around you to take the same precautions. You should understand the importance of hand washing, masking, and social distancing in preventing transmission of COVID-19. You should be able to modify daily activities to reduce transmission of the virus to others, generally explain how the vaccine works, and answer questions regarding the role of COVID-19 vaccines and boosters in preventing the spread of COVID-19. The COVID-19 pandemic is surging in some ways right now at this moment. We have about 107,000 cases per day. We have an increase in hospitalizations from the last 14 days. And so in your areas where you are at high levels of community spread, it's important when you are indoors in the midst of crowded areas that you wear a mask. Maintain social distancing. Avoid gatherings if you can. Identify isolated cases. Protect healthcare workers. Protect high-risk groups. And again, in terms of contact tracing, that is being done on a limited basis now with the widespread vaccination rates that we have. And of course, quarantine and isolation for appropriate times. Again, if you're found positive, you certainly have to isolate for 5 days and of course wear a mask for another 10 days. And of course, postpone travel if you have to, if necessary. And of course, when you're aboard a plane, you have to wear a mask. And of course, wash your hands and vaccinate wisely. Now, how to wear a mask correctly. Do not wear a mask below your nose. Your nose can actually transmit an infection, especially when you sneeze. Do wear a mask above your nose and below your chin. That covers both your nose and your mouth. And again, when you're talking, to pull your mask down to talk would defeat the purpose completely of masking. So when you're talking, keep your mask in place. How not to wear a mask. And you can see here, don't wear a mask around your neck, on your forehead, under your nose, only across your nose, on your chin, dangling from one ear, on your arm, or in your pocket. And so if you're asked, do you have a mask? You should say yes, and it's on my face. So children going to school every day, and again, being able to go in-person learning. And again, this has been limited. However, with widespread vaccination, we are in-person school, and masking is optional. And so, again, use masks when warranted, establish groups of smaller numbers of students together, faculty and teachers and cafeteria workers should be wearing masks if necessary, if they're encountering people at close range. Quarantine after exposures, isolations like we talked about. And again, if you're able to do all of this, you would see limited spread among teachers and faculty and students if you're able to maintain these mitigation strategies throughout the school year. And so, what we had seen during the pandemic is an increase in workers in meat and poultry processing facilities being infected with COVID-19. What we also know is that there are a number of racial and ethnic minorities that predominate some of these industries. And so what has been done, it has been recommended that you provide cultural appropriate health education materials to these workers, screen workers for possible infection, encourage hand hygiene and use face covering when working, increase the distance between workers. Because if one worker is infected, it's very likely that they will transmit this infection to other workers. Many workers at the meat packing and poultry processing facilities, some of them have died of symptoms associated with COVID-19. We should also encourage workers to take sick leave when necessary. And when they return from isolation and being able to show that they're COVID-19 negative. Now, there are a number of safer activities that you can do, again, if you're unvaccinated. But if you're fully vaccinated, you can do a lot of things. It includes walking, running, attending small gatherings, outdoor gatherings, and again, dining in outdoor restaurants and attended crowded areas. You still should wear a mask even if you're fully vaccinated. But if you're unvaccinated, there are more opportunities for you to be safe by wearing a mask, okay? So if you're unvaccinated, walking outside, attending small outdoor gatherings of people that are fully vaccinated, that includes family and friends, that would be okay without a mask. But if you're unvaccinated, attending small groups outdoors, dining, or attended crowded areas with live performances, you need a mask on all the time. So, as community healthcare workers, it's your responsibility to prioritize vaccinations for COVID-19. And that is, people should get vaccinated for COVID-19. And again, we'll talk more about the vaccines that are available for vaccinations for this infection. There are a number of benefits of COVID-19 vaccines. It will build your immune system to help fight the infection if you're infected. It will protect you from severe disease and complications of COVID-19. That means it will protect you from the likelihood of developing post-COVID syndrome. It will protect you from being hospitalized, from going into the ICU, or requiring mechanical ventilation. So all of these things associated with severe disease, the vaccine will protect. And of course, it will reduce your risk of hospitalizations as well. So how does the vaccine work? The vaccine will help your immune system fight infections, okay? You're given this vaccine by way of an injection. It teaches your body to produce immune fighting antibodies and immune fighting cells that will protect you if you become infected with the virus at a later time. Why do you need COVID-19 boosters? So a booster shot is something that you've had in the past. You've been boosted for other things during the course of your life in terms of infections as part of the normal vaccine schedule. So booster vaccines, they help your other vaccines work better because over time, a general vaccine will often wane in terms of its immune protectiveness. So vaccines are working well to protect you against severe disease, hospitalizations, and death, but their effectiveness will wane over time. A booster will increase your protection from COVID-19, and that includes the variants. And of course, we've seen that many of these variants will spread quickly, even more quickly, and possibly cause more severe disease than the original virus. So everyone, and that number should be changed there, everyone that is 6 months and older is now eligible for a COVID-19 vaccine. I will repeat, everyone that is 6 months and older is now eligible for the COVID-19 vaccine in the United States, okay? And again, there are a number of myths that are out there. And again, the COVID-19 vaccine will not change your DNA. The COVID-19 does not contain fetal cells or animal products or a microchip. The COVID-19 vaccine does not contain COVID-19 virus. The vaccine teaches your body how to create antibodies that protect you from COVID-19 infection. And the vaccine does not affect your fertility, both for males and females, okay? So protect yourself and your family and people in your community by getting vaccinated, okay? COVID-19 may cause mild temporary side effects like a sore arm. The vaccine can cause headache, fever, and fatigue. These side effects says that the vaccine is working and they won't last more than 2 or 3 days. And the vaccines have been found in clinical trials to be effective, safe, and they're free. So get boosters. You can get a booster for COVID-19, and they're now available for ages 5 to 11 and on, okay? And again, this is with the Pfizer vaccine. So COVID booster doses, the best way to protect yourself from COVID-19, including the Omicron variant, is to get vaccinated and boosted. Everyone 5 and older should get a booster. And again, when? At least 5 months after your second Pfizer or Moderna shot, or 2 months after your Johnson & Johnson vaccine. In summary, following CDC mitigation guidelines will help to limit the spread of COVID in your community. There are proper ways to wash your hands, and if necessary, use hand sanitizer. There are proper ways of masking that are effective at limiting community spread of COVID-19. Finally, the most effective means of controlling community spread of COVID-19 is to get vaccinated and boosted and remain current according to CDC recommendations. Module number 3, what do you do if you get sick? Treatment recommendations for COVID-19, okay? Treatment options for patients with COVID-19 who are not in the hospital. These are people that have mild to moderate symptoms. Requirement, healthcare professional referrals, health risk status including obesity, diabetes, chronic kidney disease, weakened or suppressed immune system, are taking medications that will weaken your immune system. There are a number of antivirals that are out there to stop the virus from multiplying in the body. There are also antibodies that you can purchase called monoclonal antibodies to stop the virus from spreading in the body as well. I'll talk more with detail. The learning objectives after this module, you should be able to know about the current treatment options for COVID-19, know how to treat COVID-19 symptoms, understand when to seek medical attention at a health facility for COVID-19, and know what to do when you think you have COVID-19. The currently approved COVID-19 vaccines are from Pfizer, Moderna, and Johnson & Johnson. Number of shots for Pfizer and Moderna are 2 shots. One is 21 days apart for Pfizer, 28 days for Moderna. Individuals 6 months and older are eligible for the COVID-19 vaccines from Pfizer and Moderna. Booster shots are also available for children 5 years and older with the Pfizer vaccine. Booster shots are available for the Moderna for ages 18 years and older. And of course, for Johnson & Johnson, this is a 1 shot. And again, this is only for people 18 years and older. The booster shots are available for Johnson & Johnson. However, CDC recommendations are to receive the Pfizer or Moderna booster. And again, CDC recommendations are basically favoring Pfizer and Moderna shots for primary vaccinations as well. And of course, for women that are pregnant, it's a contraindication for using Johnson & Johnson. It is recommended that they use the mRNA vaccines, Pfizer or Moderna. What can be done once you've been fully vaccinated? Once you've been fully vaccinated, you can visit people. You can visit people in their homes. You can attend private settings in one household of unvaccinated people who are not at risk for severe illness. You can travel domestically without quarantining after travel. You can travel internationally. And again, without quarantine, you can visit people. You can't visit people indoors without a mask if they're at increased risk of illness. And again, you can't attend medium or large gatherings without a mask. And again, the reason being is that there are people there that are unvaccinated, can transmit the infection, and you can get a breakthrough infection or a reinfection from one of those individuals if you're not wearing a mask. Symptoms of COVID-19, you should know what they are: cough, fever, chills, muscle pain. This is common symptoms. Some of the more severe symptoms can be shortness of breath or difficulty breathing, sore throat, loss of taste and smell. Okay? And if you're sick, the things that you have to do. So if you're sick, you have to follow these steps. You should stay at home except when you're getting medical care, attending the clinic. You should wear a mask. You should stay at least 6 feet apart from others. You continue to wash your hands. Cover your coughs and sneezes. Clean, high-touch surfaces every day. You should also stay separate from other people and pets in your home. Stay in specific rooms, in one room if you have to, as much as possible. Stay away from other people and pets in your home. If possible, you should use a separate bathroom. And if you need to be around other people or animals or outside in your home, wear a mask. Don't share utensils with other individuals, such as dishes, drinking glasses, cup, eating utensils, towels, and so forth. Monitor your symptoms. Symptoms of COVID-19, we've talked about that. Follow the instructions from your healthcare provider or health department. And of course, when seeking emergency medical attention, especially if you're having trouble breathing, you have persistent pressure on your chest, inability to wake or stay awake, you're turning pale, gray, colored skin, blue lips, and again, if there's a change in your skin tone, you need to seek emergency medical attention. 10 things that you can do to manage your COVID-19 symptoms at home. And again, like we said, stay at home except to get medical care. Monitor your symptoms, get rest, and stay hydrated. If you need a medical appointment, call the health care provider, okay? And of course, talk to your community health worker. If you need medical emergency, call 911. Cover your coughs, wash your hands, stay in specific rooms, avoid sharing personal utensils, clean all surfaces on a regular basis. And so we see, if we look at these symptoms, there are the serious symptoms, the most common symptoms, and the less common symptoms that we've discussed before. Okay? So shortness of breath, loss of speech or confusion, or chest pains. This is an emergency visit. A number of these other things are going to be different symptoms associated with COVID-19. And of course, testing for COVID-19 is very important to make sure that you're actually having a COVID-19 infection. Therapeutics that can inhibit COVID-19 virus replication and spread. Remdesivir is an antiviral drug, and it's the first drug to be fully approved by the FDA for the treatment of hospitalized COVID patients over the age of 12 years old. This is delivered by an IV drip, and of course, again, these are people that are in the hospital or likely to be hospitalized. Molnupiravir is an oral antiviral pill that's approved for emergency use authorization for anyone 18 years and older. This is an oral antiviral that has been produced by Merck. And of course, it has a 30% effective rate in terms of reducing COVID-19 mild to moderate disease in those individuals of the recommended age. And then there's Paxlovid, which is an oral antiviral that's produced by Pfizer. It was approved for emergency use authorization for anyone 12 years and older. And of course, those individuals that are at high risk for severe disease. And again, we have also monoclonal antibodies that have been made in the laboratory and used to block the spike protein of the virus and prevent virus injury into cells to initiate infection. We also have convalescent plasma that involves giving plasma containing antibodies from against COVID from a patient that has recovered from COVID-19 to help protect hospitalized patients from developing severe disease or dying. So the antivirals for treatment of mild to moderate COVID-19 infection includes Paxlovid and Molnupiravir. And of course, both of them have been shown to be effective. But again, Paxlovid have a number of drug-drug interactions and contraindications that should be examined by a physician before prescribing. The monoclonal antibodies are for mild to moderate symptoms. Again, this is by way of referral from your doctor. This is for people 12 years of age and older that are at high risk status. That includes those individuals that are obese, are diabetic, have chronic kidney disease, immune suppressed, are taking medications that will weaken their immune system. So you've just tested positive for COVID-19. You have mild to moderate symptoms. Oral antivirals may be just what you need in the form of Paxlovid and Molnupiravir. Monoclonal antibody infusions are also something that could be considered for a person in this case. However, if you have severe disease associated with COVID-19, where you have been hospitalized, undergoing mechanical ventilation, then these treatments may not be appropriate. This is for early disease as opposed to late stage disease. And so I just want to say something about convalescent plasma transfer therapy. So a person that has had SARS-CoV-2, that has generated neutralizing antibodies, they give a blood sample. That blood sample undergoes plasmapheresis to extract the plasma. In this convalescent plasma, you have antibodies to the SARS-CoV-2 virus. When you give that plasma by way of infusion to a patient with COVID-19, these antibodies now are available to prevent the virus from replicating or binding to permissive cells in the body. The result is a recovery from COVID-19 in terms of patient recovery, or for that matter, improved COVID-19, where you have improved symptoms, allow this patient to come off of mechanical ventilation, or for that matter, to begin recovery. In summary, remember, most people who get COVID-19 will only have mild symptoms. These symptoms must be treated at home. Take steps to prevent exposing other people to the sickness. Monitor your own health. Treat yourself. Seek emergency medical attention when needed, and practice CDC mitigation and prevention strategies to prevent the spread of the disease. Module